Events happen that change our lives. Dealing with change is what we do. We discuss with industry professionals objective solutions to work through cherished items and family memories. When we go beyond the gavel, we provide tools and information to deal with these crisis times. Hi, I'm Shane Feely with Auction Solutions. Today we're going to go beyond the gavel with the attorneys from Vandenack Weaver Law Firm. They have a lot of regulatory, estate, and other planning issues that need to be talked about during this time of COVID virus. I have Matt Dunning, Jim Pieper, and Monte Schatz. We're going to start with Matt today. Matt, tell us a little bit about some of the changes and things that we really need to be aware of right now.
Yeah, thank you. We over the last several days, there have been so many emerging developments at the federal level, at the state level, just whether it's regulations, new legislation, interpretation of existing guidance or regulations, or just the general crisis that we're facing in terms of how people are supposed to react, how people are supposed to engage with each other, social distancing, self-isolation, this whole new catalog of words and terms, some of which are kind of strange, frankly. So we have seen a lot of new things, and part of that is federal legislation, which is seemingly about to be passed, but that was the case on Friday and again on Monday and still today. Jim's going to be talking a little bit about that. And the one thing I would note is that we're getting federal legislation. We're also seeing state legislation. Colorado has enacted some things. We have a county in Iowa that is establishing its own set of protections for employees, and then San Francisco. So it goes from federal, state, county, local, all the way up and down.
And your specialty is business. What do I need to know as a business owner to protect my employees right now?
I've been practicing employment law, representing primarily management, primarily businesses for over 25 years. And obviously, I think everyone's primary concern is the health and well-being of their employees, of their customers, of their management. And I think that should be the beginning point. As a result, you have the opportunity to protect everyone, but you still must be doing that within the law. So some things are new, but a lot of the things that are new are things like paid sick leave. But other things are what is old is new again, I guess. We've had prior pandemics, and in 2009, the Equal Employment Opportunity Commission at the federal level issued some guidance about how to handle certain things that employers are facing now.
Sure.
So there are some fundamental principles that are going to apply. Probably the biggest issues are Americans with Disabilities Act issues, Family Medical Leave Act, OSHA, and wage and hour. So we can start with the Americans with Disabilities Act, because that's what a lot of the questions we're getting right now is, what if an employee is exhibiting symptoms of the virus? What if an employee is exposed to a known case? What if they have a case? So what we have been doing is helping employers make this direct threat analysis. And under the ADA, generally speaking, you're not permitted to conduct a medical examination of an employee or require a medical examination of an employee unless you're determining whether they can perform the essential functions of the job. So that's not applicable here, but the other side of that is whether or not they present a direct threat to themselves or others. So under that umbrella of regulations, an employer is only allowed to require the fitness for duty certification or a doctor's note if the employee has it constitutes a direct threat of harm to the workplace. So what we've been advising employers is to not jump to conclusions, to look at the specific facts that are applicable, and particularly with such issues as, has the employee visited a healthcare facility? Have they been in high exposure communities? Have they been in communities where there's been community passage of the virus? Have they been in foreign countries that are designated as high risk?
Okay.
Based on that, we have advised employers to go ahead and either send them home, either way, but then to either get a medical certification or to do things like we represent a manufacturer, producer that has a practice of monitoring employee temperatures regardless because of health and safety concerns unique to their industry. And so when they've had an employee spike an elevated temperature, sent that person home, they usually allow an employee to simply self-report that they are clear, but in this instance with the heightened risk, we're recommending either a doctor's note, which should really be based on a test for the virus, or continued monitoring of those temperature levels when the employee is trying to come back.
You mentioned the tests. I know that tests are a little in short supply right now, aren't they?
Yes, they are. And there's other issues such as just access to a physician to get a fitness for duty certification or a return to work note.
Sure.
So the community is hoping that, industry is hoping that there will be some streamlined process to get testing and to get a certification that may not require a complete physical exam by a doctor. So very fluid, definitely emerging. One of the reasons there's federal legislation pending and also the state and local is because if you have an employee who you're sending home, they may or may not have paid time off. They may need to take, if they're an hourly employee, they may not get paid as a result. Some employers are going ahead and paying employees because the issue becomes if an employee has the illness or believes they might have the illness, they may not come forward because if they do, they know they're going to get sent home and they won't
Absolutely.
get paid. So the entire policy impact of the proposed legislation is to make sure that those who are exposed or exhibiting symptoms or who are sent away from work because of the virus still have the potential to get compensated and avoid that sort of hidden risk factor that otherwise would be there.
How long can an employer though go if we're unable to do business as usual? How long can employers afford to be paying these people for their 2-week or 3-week?
Yeah, it's very limited. The people we've consulted with, mostly have paid time off programs, so there's a bit of a buffer. But I'm talking to an employer today that is looking at layoffs instead of, there's just a lot of issues with unemployment insurance. So if an employer is going to lay off employees, then they will be able to file unemployment comp. If they have paid time off benefits available, employers are required to pay that out to the employee, and then that'll be an offset against the claim for unemployment.
I see.
So it's a choice of whether to send people home, keep them on paid time off, maybe extend that a little bit, or go ahead and do a layoff and face the unemployment claim. And hopefully, things recover sooner than later and people are able to get back to work as normal.
And Jim, you're a legislative specialist. You spend a lot of time reading the new laws and things. Do you have anything to add?
Well, our understanding of how this is being addressed in Congress, and part of what it goes to the question of how the businesses are going to deal with the cost of giving people time off. Congress, as we understand it, is basically dealing with it in 3 phases. They passed what was called Phase 1, which was basically the government's response and more money for the government to be able to deal with the crisis. Phase 2 is supposedly going to pass today, Wednesday, from our understanding. And that's dealing mostly with the employment questions and the insurance questions. And what's in there is a new category of a federal mandate for emergency paid leave, sick leave, which can last for 2 weeks, basically 10 business days. And there are two levels of that. One is for people who actually are showing symptoms or isolated because of a medical reason to quarantine or isolate themselves. And people in that category are going to be entitled to a full sick leave at full pay for the 10 days. And then the second category is people who are caring for another family member or someone who's home from school or child care because of the closures. And that is going to be entitled to 2/3 of your regular pay for that emergency sick leave under that category. And the funding for that is the federal government is up to a point saying we will reimburse employers 100% of that cost through a tax credit, payroll tax credit. So the question is going to be the timing of that and how does that work with what actually you have to pay your employees. But the goal of that is to cushion employers with a federal tax refund that's going to allow them to give that 2 weeks of pay to people in those two categories. And then there's also an additional provision for an extended family leave, which can go up to 12 weeks.
Wow.
And the family leave is for people who are unable to work because they're taking care of a child school age or preschool because of closures to the school or the daycare. And again, that's at 2/3 pay, and it's supposed to be reimbursed 100% of that cost through the tax credit. Where the issue arises is where you have the closures or the people who are staying home just because of social distancing or because of economic disruption, where the business can't stay open. Now, those are people might not have any symptoms or exposure, might not have school-age children or family obligations. And right now, that's not covered in this phase 2.
I see.
So our understanding is they're coming up with a phase 3, which is a much broader sort of economic stimulus that's supposed to involve, tax credits and support for particularly liquidity for businesses through small business loans and tax credits and things like that. And we haven't seen much of how that's going to play out yet at this stage, but that's something that we'll keep on top of. The other thing that's in this bill that's likely to pass today is on the employee benefits, and it requires basically all types of insurance plans, and includes Medicare, Medicaid, VA, and all of that, basically to cover the testing, the diagnostic process, the office visit or urgent care visit, emergency room visit that leads to a test without co-pays, without co-insurance or deductibles, and that's also supposed to take effect again right away with this
That would be nice.
new legislation. So.
And they're also not talking weeks on the virus anymore. They're making it sound more like months that we're going to be dealing with these issues. So I'm so glad that you guys are in here to talk about it today. Monte, do you have anything to add?
Well, one thing I just wanted to add, and this is in general terms, this isn't the Center for Disease Control and Health and Human Services and the FDA do have regulations that if we do start honing in on a immunization that might be effective against the virus, there's been a lot of, and justifiably so, there's been a lot of discussion out there about, well, great if they identify something that's going to attack this virus and, mitigate or eliminate it. Is it going to be months? And under a typical scenario, that is true. However, the FDA does have a fast tracking is one of them. They do have 4 different processes where they can accelerate this process if necessary, and it's meant for exactly like situations like this where we have a pandemic event. So if there's one positive, I know there's been a lot of doom and gloom out
Sure.
there with this. You know, hopefully, and it seems like there are people honing in on this, and I'm not saying it's going to go from months to weeks, but at least we can be assured that if they identify something that looks like it's going to be effective to treat this pandemic, our government does have means and regulations that allow us to expedite the approval process.
Well, I noticed the prime lending rate has dropped considerably. What is the outlook for that? You guys have any opinion on that?
Well, I think it's as low as they can make it right now. It's 0 to
0%.
1.25, I believe, and
Yeah.
So that capacity is taken. So I think that's why you see the billions and trillions that are, you know, either have already been pumped into the economy or will be. That is that's happening on a global scale, as I understand it.
Sure.
I guess with that long-term prospect, you know, employers are looking at if employees need or are able to work and then are able to work remotely, employers are starting to look at the big picture of that and say, what do we need to do to support the employees when they are working at home? It's one thing for someone to take their own laptop and go ahead and work for a couple of days from home, you know, on a sporadic basis, and then return to the office environment. But once you have, you know, an extended amount of time and it's day after day, you start to, there's going to be issues about internet access, you know, needing a printer or other equipment, even a, you know, a different computer so
Sure.
that people can do their work. So a lot of small employers are not set up for that at all because they don't have any interest, as a general matter, in having their employees off-site.
Yeah.
You know, our firm itself is going through, you know, this analysis, and we are setting up, you know, different video meeting capabilities, and we'll be going through making sure that our employees have the necessary access to keep things rolling, because right now we're getting a lot of questions.
Yeah, well, and I'm a small business person as well, but a lot of our work is in people's homes and in person, and we've backed off a little bit and kept our teams out there to be more careful, just to keep ourselves out of trouble.
Yeah, absolutely.
And on that regulatory front, there were various restrictions over the years in terms of providing health care on a remote basis, some of the more privacy issues, reimbursement issues, and just yesterday there was some new developments that added flexibility for healthcare providers to use more conventional like Skype or FaceTime or those types of ways of communicating with patients, and then Medicare loosened up its reimbursement so that those types of visits will be covered by Medicare, and that should open up hopefully a lot of opportunities for that type of remote access to healthcare and
Right.
for people who are trying to isolate. So,
To follow up on a point that Monte made in terms of guidance and information coming from the CDC, Nebraska Department of Health and Human Services, you know, private associations, any number of sources. There's a ton of information out there, and it needs to be filtered. But we do refer our clients to the primary source of some of those guidances and information, simply because getting the information out there is primary, and then if they have questions about how it applies or an analysis of something that is a little in the gray zone, then we're helping them with that. That goes to also like remote work policies. Sure. And you know, probably the primary issues that people are facing is, you know, whether or not to send people home, and so we're getting a lot of questions on that.
Well, I own a restaurant, and we're doing curbside and call in and whatever.
Yeah.
You know, there's a mobile delivery system out there, whatever they'll use. So we're doing kind of the same way. We're afraid to have a lot of people in the restaurant. Not that they're sick, but we just don't want the liability.
Yeah, this is so broad-based, it's hitting every industry, you know, so that's airlines and hospitality obviously are, you know, including restaurants, getting hit really hard, but every environment is. OSHA issued recent guidance and has 4 levels of risk factors, exposure factors, I guess, for employers to look at. And it goes all the way from, the healthcare employees who are actually treating a person with COVID-19, all the way down to, your administrative type employees in a standard office environment. And OSHA, has different guidelines that are applicable to each of those categories. In general, employers are still allowed to require employees to come to work unless the employee has a reasonable belief that there is an imminent danger, which is a pretty high standard to meet. So I think people are being more flexible now than they might be in the future as far as what the risk is. There's also been questions about whether an employee can demand to wear a mask at work, and there appears to be no justification for that, and that that not only would they need to establish that there's an imminent danger that would be accommodated by a mask, but apparently wearing a mask really isn't that effective.
That's what they're saying now.
Yeah.
Yeah.
And masks are sold out anyway.
That's right.
So.
Let's leave them for the people that really need them in the medical industry.
Right.
Do you have anything to add, Jim?
Well, I think what we've seen in the guidance is that almost all employers are going to be in the low to moderate risk categories. It's really only people in a healthcare, or treatment or emergency treatment response setting that are going to be in these higher categories. And so for the low and moderate risk, it's pretty much the same type of stuff that you've been hearing from everyone, which is, wash your hands and use the hand sanitizer and keep the surfaces clean and on all of that. And the latest guidance, of course, is the 10 people or less in a gathering. And in terms of like the legal obligation, as long as you're paying attention to that and you're notifying people of what their obligations are, then you're going to be living up to the employer's general standard of keeping a safe workplace and a work environment. So I think most people, certainly in the environment we're in now, are paying attention to that and are going to do what's best for their employees and their families. So, Monte?
Well, I just think, to summarize, I think the word of the day is, so much that comes, from the media, and I'm not knocking them. They're reporting responsibly, I think, on this for the most part. But we're being bombarded with all this information at almost a fearful level. And I think what we got to look at is that our government and individuals and our businesses are reacting to this. And the word is not fear, but mitigate, minimize the damage, as much as we can. Help get this curve flattened out.
Sure.
And we just all got to do our parts as individuals and businesses to take care of these things, and I think our government's taking steps to do that. And the other thing is I always like to try to find a silver lining in the cloud. If this thing goes on a long time, we've found a lot of times some of the most productive and innovative businesses are formed during times of crises. So the economy's not coming to a screeching halt. I mean, it's going to be a tough cash flow situation for a while, but our government's taking steps with stimulus and so forth to help, again, mitigate that lack of cash flow. But there will be positive things that can come from this.
And didn't you guys just do a podcast yesterday? And so Vandenack Weaver's on the leading edge of keeping people informed and...
Yes, we're trying to get the information out, whether through postings on LinkedIn. We've got a clearinghouse established for information from a variety of sources, and that's available through that platform. Then the webinar, and then there's all the information's also on our website.
Oh, that's great.
And really, we're posting daily. I think really daily, except maybe not on the weekends, but
react as quickly as we can.
Well, the information's coming out so much every day. You just don't even know where to go to find the truth. And there is truth in what they're saying, but... Yeah.
I saw an email the other day that said, not a coronavirus update. Because otherwise I think people are they're overwhelmed
Right.
by the information. I got one from a barber that I hadn't seen in 3 years, so,
Yeah.
I mean, it's just,
Well, that's kind of, but then people are reaching
good to
out
get
for,
it out, but
and they're
yeah.
reaching out for good information too, because it seems like when you get the rumors and innuendos going, then, people begin to be fearful, and I'd rather have more good information out there than have them being fearful.
yeah, absolutely.
Yeah.
Is there anything else you guys would like to add as closing?
I would just say, that some of these new things, where the paid sick leave is going to be established to help people that are directly impacted, whether they're diagnosed or have an exposure or have the school closures, as Jim mentioned. The school closure, that's hundreds of millions or tens of millions of people. And so that's all very good. There's also the unemployment compensation and COBRA continuation coverage if people do lose their position or do have a reduction in hours. So there are safety nets in place, and the government's going to be doing more and more.
Great.
Yeah, one other area that there was just a pronouncement that came out just this week from the IRS is those who have had trouble with payment of their tax obligations, where they've done what we call an offer in compromise or an installment agreement for back taxes that they've owed and worked that out with the government. The IRS is pretty unforgiving, and similarly the state regulatory departments are pretty tough on if you don't comply with those provisions, and they've given basically a 90-day moratorium to start with on this,
That's good
on
news.
making payments. So they won't pull the deal off of the table if you don't make
Right.
payments, because they recognize the lack of cash flow for the taxpayer to do that.
I think all tax payments are able to be deferred for 90
Right.
days if the
That's nice.
taxpayer chooses to. So.
That's great.
Right.
Well, again, Monte Schatz, Jim Peters, Matt Dunning, Vandenack and Weaver, attorneys at law. Thank you guys for coming out today and being on the show. I know it was important to you to get this information out, and we will get it out very quickly. Thank you very much for coming today.
Thank you.
Thanks for the opportunity.